know that there are over 20 FDA-approved medications for insomnia? One medication that's commonly prescribed is not even FDA-approved for it. This medication is called Trazodone. It's actually an antidepressant that has some sedating effects. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert. Today, we'll learn more about Trazodone. So Trazodone is primarily an antidepressant, but it's often used off-label to treat insomnia. And it's actually more common to see Trazodone used for sleep these days rather than an antidepressant. So how does Trazodone work? It actually can influence our serotonin levels in the brain, which helps improve sleep quality. Researchers also believe it may work on lowering our cortisol levels through the hypothalamic pituitary adrenal axis, which can contribute to some of the sedating effects or improvements it has on insomnia. Additionally, at lower doses, Trazodone can have an antihistamine effect similar to Benadryl, which makes you feel drowsy and sleepy. Let's take a look at what the studies show. One study linked below shows that nearly 4,000 participants who took Trazodone did have an improved sleep quality, woke up less at night, and fell asleep longer on average by about 28 minutes. One thing to keep in mind though is that the dose for Trazodone is a little bit lower than the dosage for depression, somewhere between 50 to 150 milligrams. What are some of the benefits? Well, it can be effective for many people, and that's probably why it's so commonly used, especially for those of us who have difficulty staying asleep throughout the night. Another benefit of taking Trazodone is that there's a low risk of dependency. Unlike other sleeping aids where your body gets used to it and you just need more and more to have the similar effect, we don't see that with Trazodone. I feel like working with some of my patients who are on it, it either works or it doesn't work. As compared to some of the typical sleep aids, such as the benzodiazepines or the Z drugs, it's supposed to not impair your alertness the next day as much. Another benefit is that it's pretty cheap and it's not a controlled substance. Some of the cons, well, it's very sedating, and I guess that's why it could be also the benefit. For some people, it does make you feel a lot drowsier than you intended the next day. Another potential side effect, and these are things that we commonly hear, are either dry mouth, dizziness, or headaches. And anytime you take a pill, certainly it can cause some GI upset like nausea. A word of caution, it may interact with other medications such as antidepressants or blood thinners. And as always, before you introduce a new medication or supplement to your routine, talk to a licensed healthcare provider and see if it's a good fit for you. So in summary, Trazodone may be an effective and relatively safe option for people who are having struggles with insomnia, but no, some of these medications are really only for short term. One of the best ways to treat insomnia is something called cognitive behavioral therapy, where you can train your brain how to sleep again. But with that said, actually some of the reports show mixing Trazodone on top of cognitive behavioral therapy, the results for improved sleep are even better. Alrighty, if you have any questions about Trazodone, go ahead and put them in the comment section below. Thanks for watching, and if you found this video helpful, please like, subscribe for more. Until next time, sleep well, and see you in the next video. Bye-bye.